Welcome back. Today on World Malaria Day, we have the pleasure of speaking with Mr. Ben Nangombe, the Executive Director of the Namibian Ministry of Health and Social Services. Mr. Nangombe speaks to us about the fight against malaria in Namibia, of course the crucial role the ministry is playing in strengthening cross-border collaboration with neighbouring countries to combat this disease. We will discuss the current state of malaria in the country, the challenges faced and the strategies being implemented to achieve the goal of malaria elimination. Mr. Nangombe, good evening and thank you so much for joining us here on the Daily Roundup.
Good evening, Nina. How are you today?
I'm good, sir. How are you?
I'm doing very well. Thank you very much.
You're speaking to us tonight from Korihas, where the ministry is, of course, commemorating World Malaria Day. How did today's events transpire?
No, the events went very, very well. We had the launch of, or rather the commemoration of World Malaria Day today in Korihas. It is an event that was attended by many attendants at the town of Korihas. But as I speak to you now, speaking to you from Opuo, where we have another event in the Opuo district tomorrow related to the matters of health. But I think the importance is that we launched, or rather we commemorated Malaria Day 2024. We shared messages with members of the community about the importance of eradicating malaria, and we believe that we have the necessary momentum to keep going to ensure that we actually achieve the goal of a malaria-free Namibia by 2027.
And what is the current status of malaria in Namibia, and how does it compare to previous years?
Yeah, I think we have made very good progress over the years, starting from 2019. We saw an upsurge in the cases in 2021 to 2023, but generally, the numbers are coming down. We are containing the outbreaks that have been recorded in the endemic regions, particularly of Zambezi, Kavango East, Kavango West, or Hangwena. But generally, the picture looks stable, and that is why we are confident that the measures that we are putting in place are effective. That is why, for example, today, we decided that the internal residual spraying for 2024 is to start early. We launched it today to start countrywide in the different malaria regions, and this is for us a very important milestone going forward.
Mr. Nangombe, speak to us about the ministry's plans and strategies for achieving malaria elimination within Namibia, and what role does World Malaria Day play in raising awareness and, of course, mobilizing support?
Yeah, we have a national malaria elimination strategy that is started last year, 2023, is going until 2027. It encapsulates or involves a number of interventions. We have the combination strategies ranging from the barrier method, meaning that we are providing, for example, mosquito nets so that people protect themselves from mosquitoes so that they are not exposed. We encourage people to use long-sleeved clothing, again, so that they are not bitten by mosquitoes. We have the indoor residual spraying. This is where we use insecticides to spray the indoors, the insides of dwellings, so that, again, that helps to kill the mosquitoes. We have a process called larviciding, whereby stagnant water where the mosquitoes can breed are treated in order to kill the mosquito larvae. We have also interventions in terms of providing treatment to those that are affected by, or those that are infected by the mosquito, so that we treat them medically to be able to get healed when they get infected. In addition to that, there are other interventions as well in terms of community awareness. We have recruited community health workers who educate members of the public about how to protect them against mosquito bites, what they need to do so that they practice what we call early health seeking behavior, so that if somebody feels unwell, they present themselves to health facility where they can be tested. We have the necessary equipment at hospitals to treat these people. We have laboratory equipment to be able to analyze the samples when they are taken. We have a strategy of what we call test and treat. So when the community health care workers go out in the community, they have the equipment to test the people in the communities, and those that are found to be positive can be treated with the anti-malaria medicine so that we help to restore their health. And particularly, this community education is targeting particularly expected mothers who tend to be vulnerable. Also, young children tend to be vulnerable to malaria. So what we do is to provide education to these individuals so that we combat the spread of the disease overall.
Mr. Nangombe, before I let you go, I just want to move our focus to something else as well while I have you on the line. The Africa CDC has recently declared the ongoing mpox outbreak a public health emergency of continental security. So what are your thoughts on this declaration, and how does it impact Namibia's preparedness and response efforts?
Yeah, basically, we are aware of the declaration of mpox as a health emergency of continental security that was declared by the Africa CDC. We as a country have been monitoring the epidemiological situation related to mpox on the continent. Our surveillance mechanisms are in place to ensure that we are able to pick up on any cases that may enter our country. Our healthcare workers are practicing what we know as the high index of suspicion, so that if anybody would come into the country and they have symptoms that are consistent with the disease, they can be identified, they can be isolated, and they can be treated accordingly. We, as a country, learning from the experience of COVID, have put in place isolation facilities. For example, we have trained our healthcare workers, whether it is in terms of surveillance, whether it is in terms of case management. We have the emergency medical teams on the ready to be able to respond should cases, for example, make their way to Namibia. We know that the world is now a global village. An infection in one part of the world can spread very rapidly to other parts of the world, but we are at least fortunate in the sense that at this point in time, Namibia has not recorded any case of mpox in the country, while of course we know that there have been cases reported in neighbouring countries such as South Africa, for example. But as I'm saying, we are on the ready. Our port of entry officials are on the ready, and we are conducting surveillance activities that would enable us to pick up on cases that may enter our country of this particular disease that was declared as such by the Africa CDC.
Well, that's great to hear. On that note, also, Mr. Nangombe, we thank you for your time and for speaking to us this evening. All the best in Opor. Thank you so much.
Thank you very much, Anissa.
That was Mr. Ben Nangombe engaging us there. When we come back, we still have more to talk about here on the Daily Roundup with Nina. Stay with us.